Hey guys, it's Maura. So in this video, I want to do a few case studies to kind of use what we know to help you guys figure out what could happen in a real life situation. So the first one I'll read to you guys, and I'll also put up on the screen here. So if you want to pause it, and that can help you, you can look at things a little at your own pace, I guess. So, first case study, an 81-year-old female in the ER is complaining of severe nausea, vomiting, and a general feeling of malaise, which just means like tired, lethargic, just not feeling very good. She is very thirsty. So, when you think thirsty, what do you think? Okay. She is currently under treatment for hypertension. A CMP showed an increased potassium and a markedly elevated glucose. So it means her glucose is really high, her sugar is really high. Blood gas results were as follows. So her pH is 7.32. So based on our range, we know it's 7 to 3.5, 7 to 4.5. So anything less than 7 to 3.5 is acidic. So she's acidic. Her PO2 is 96. So her oxygen's okay. Her CO2, her PCO2 is 28. And the normal range for that is 35 to 45. But less than 35 is basic. And then her HCO3 is 16, which the normal range for that is 22 to 26. So anything less than 22 is acidic. So she's acidic. So using our little chart, which I'll put it in here. So we start out with the pH, and she is acidic. Then we go down. Is her HCO3 down, or is her PCO2 up? And we know that her HCO3 is down because it's only 16. So then we have first degree metabolic. So we know that she's using her kidneys to try to compensate. And another key indicator of that is blood pressure. So your kidneys have to do with your blood pressure, and increased potassium. When your kidneys are going through like renal failure, a lot of times you can have an increased potassium because it's not filtering that out. So then we go down to, is the PCO2 decreased? And it is, because it's trying to compensate by making that basic. So you end up with having partially compensated metabolic acidosis. So she's not completely compensated because her pH is not normal. So, and what our little case study says, metabolic acidosis, partially compensated, which we said, and the patient is experiencing diabetic ketoacidosis. So when you have that high glucose, that's an indicator that they're diabetic. And anytime you see a super high glucose, you think DKA or diabetic ketoacidosis, and so you're going to have your body trying to compensate for that acidity. It says the markedly elevated glucose, increased thirst, acidic pH, and decreased bicarb support this diagnosis. The change in her PCO2 and related respiratory changes are not sufficient to correct for this metabolic acidosis. So her CO2, trying to be more basic, is still not enough to make her pH normal. So that's how we ended up being partially compensated metabolic acidosis. Okay, next one. Okay, so our next case study is a known diabetic 13-year-old female in the ER for vomiting has the following results. So she has, that would be a low sodium, potassium, I think that's okay, CO2. Now that is a very low, it's a total CO2, but it's only 8. That's a very low CO2. So a lot of times with diabetic patients, their CO2 is low if they're sick and they're throwing up a lot, or even non-diabetic patients. You're just releasing all that CO2 so you don't have it in your blood. Glucose 615, obviously high. Protein total, pretty sure that's high. pH is only 7.02, which is very acidic. And then you have a PCO2 of 11, which is a very basic. Anything less than 35 is basic, and then hers is at 11. And then HCO3 is 3, which is very acidic because anything less than 22 is acidic. So we want to figure out the acid-base status. First we want to look at pH. So pH is acidic, it's 7.02, so we go down to the acid side. And then we have, does she have a decreased HCO3? Yes, she does. And so we'll go down on that side. She does not have an increased PCO2. So we know with the decreased HCO3, it's a first degree metabolic. Then we want to go down, does she have a decreased PCO2? So her PCO2 was 11, and yes, she does have a decrease. So that's partially compensated metabolic acidosis. So it's still not fully compensated. The pH is obviously still very, very low, but with the decrease in PCO2, that's a base status. It's trying to compensate for how acidic she actually is. So let's see what this little chart says. It just says metabolic acidosis, partially compensated, which we said, and the reason is for diabetic ketoacidosis, which a lot of times that's the reason for these. Okay, so our next one, we have for a case study, patient in ER experiences shortness of breath, high blood pressure, decreased level of consciousness, so like coming in and out, and blood gas results were as follows. So pH 7.16, that's a low pH. We're going to go down on the acid side. PCO2 is 115, and that is very high. Okay, so that's very acidic. So we have an increase in PCO2, so we're going to go down that side, and that now we're at first degree respiratory acidosis. And then does she have an increased HCO3? Let's see, her HCO3 is 44, which is an increase, and so that's basic. And so then we'll go right down below that, and it's partially compensated respiratory acidosis. Make sure we're right. We have respiratory acidosis, and the reason is respiratory failure. So, you know, obviously you're going to have some type of respiratory failure if you're having a shortness of breath. Your blood pressure is trying to get your oxygen everywhere. Her O2 was 87, which isn't bad. That's within the range. Let's see, do we have one more? Okay, this one, there's no background. We just have numbers. So you may not always have the whole full story, you just, you know, without all the words. Okay. So, oh, there we go. One more page. Sorry, I got all these papers. Okay, so this case study, we have a pH of 7.66. So based on our range, that's greater than 7.45, so that's going to be basic. So we'll go down our little graph under alkalosis. Then we have a PCO2 is 56, and that is acidic. Now, we don't have that an option under alkalosis, so we're actually going to go look at the HCO3 first, which is 36. So our HCO3, 36 is basic. So we have an increase in HCO3. So we go pH, alkalosis, go down to HCO3, increase. So that's first degree metabolic, alkalosis. And then it asks if we have an increase in PCO2, which our PCO2 being 56. That is increased because it's greater than 45. So we have a partially compensated metabolic alkalosis. Now, gives you some other information like the PO2 being 82 and the VE being -3, which as I said before, the range is from -2 to 2+, so that's also out of range. And then saturation is 89, oxygen saturation. So they have just the answer being metabolic alkalosis, which is partially compensated because the pH is increased, the CO2 is increased, and the HCO3 is increased. So yeah, I hope you guys like this video. If you want to hear more about acid-base status or case studies or something like that, I'll try to find some more. And just comment down below what you want to hear more about. And I'll see you guys in the next one. Bye.